It's an unfortunate reality for many women. At the doctor's office or hospital, they voice their concerns about their pain only to be dismissed. This pain gap leads to women being underdiagnosed and undertreated. Dr. Natalie Gentile with Direct Care Physicians of Pittsburgh is here to join us to talk about this growing conversation. And I'm so glad that we're having it, because I feel like for so long it was something that women just bared the burden of and only talked with their close friends about.
It's interesting, whenever I post about this type of stuff on social media, it gets so much interest because people just want to feel heard.
Yeah, and you do a lot on social media. I'm so glad you brought that up. There's so much good content there, and you're really talking about the issues that matter to so many people. Let's talk about this recent study. It showed only 45% believe that healthcare providers take their pain seriously. Why do you think that is?
I think it's multifactorial. One thing is we don't have a lot of time with patients. So in our current traditional healthcare model, 7 to 12 minutes with a patient, you're not going to be able to address everything they want to talk about. And therefore, when people are already hesitant to bring up their pain, they're probably not going to get it in those first few minutes, and then it might just be completely unaddressed.
It's really hard to hear. There are some examples, too, of women who visit the ER for chest pain, for example. They wait 29% longer than men to be evaluated for possible heart attacks.
Yeah, I was looking at that study, and it's even worse. That study was showing if you're a Black woman.
I was going to bring this up, too, because I've seen a lot of comments about shared experiences, and for African-American women, they say, if you think that's bad, try being in my shoes, because you don't get hurt at all.
Another category we see of patients who are really being dismissed is people who are at higher weights. So their pain is often diagnosed and not addressed. And we are missing out on big populations here of people who desperately need help but aren't accessing the healthcare system.
So there are more examples too, acute abdominal pain. And I have actually heard personal stories about this. 25% less likely than men to be given some painkillers for their pain, or more likely just to get a sedative. Yeah.
Sure. So I think what happens with women is we are often dismissed as it's anxiety, it's hysteria, we're overreacting, right? And that is not a diagnosis. Right.
Right.
You have to see a person eye to eye and actually evaluate them for what they're presenting for, regardless of what your bias is as the treating physician.
I remember this was in my mid-20s, early 20s. I had a cyst rupture, and trying to even get in to get seen, they were like, "Oh, you'll be fine. You have to wait for the blood to leave your abdominal cavity," and you're like, "What? But I can't move. What are you talking about?" And it feels like you're not being heard, and that it's normal, and that you just have to live through it.
Sure, and even when the trajectory of your issue may be normal and there's not much we can do, you need to have that explained to you and your questions answered. And I think that's really a big thing we miss out on.
This was a couple months back, had a big conversation in the newsroom and with our producers too about women who are getting IUDs put in. And there's a lot of social media videos about this too, that women say, oh, they just come in, they say, did you take any Tylenol? You should be okay. But it is an excruciatingly painful process for a lot of women. Again, it's seen as, a means to an end. You just have to do it. It'll be over in no time and you'll be fine. It doesn't seem like that would happen for men if they were getting something similar done.
Oh yeah, well, I mean, sometimes men are getting vasectomies done in an operating room. So
well, that's what I mean.
Yeah,
like,
I mean, we've just
crazy.
got different handling of things here. I think nobody's pain should be dismissed.
Right.
Male or female, right?
Yeah.
Or trans. I mean, nobody's pain should be dismissed.
Right, exactly.
Regardless of your gender identity, regardless of who you are, you deserve time and care and compassionate care.
So tell me what you do under your facility at Direct Care Physicians.
So when I have that time with patients and a relationship with patients, we can come up with, if you know we're having a procedure, let me explain it to you and talk about what your pain management options are.
Right.
Right, let's come up with something. Knowing you, if you tend to have, higher experiences of pain and you're really afraid, can we talk about it first and make sure that you're comfortable?
Right.
And also, I think there's that anticipation leading up, for example, to procedures that people have. And if you're waiting forever and ever and ever, that anticipation and anxiety gets worse. My patients don't wait. So,
right.
So I think that kind of takes that away as well.
That anxiety too. Endometriosis is another one that's a big thing. Women suffer for so long with something that is excruciatingly painful for them. To be told, this is a normal menstrual cycle, you're just experiencing pain a little bit differently, and it's nothing. to find out years later that they have a true condition that's causing it.
Absolutely. So if you are somebody who has a uterus, you could have endometriosis. If you are experiencing pain, talk with your doctor about it. It is absolutely something we do not identify frequently enough. And that's scary because people are suffering for years before that's even addressed.
Very quickly, let's talk about some of the things that you already brought up that you're doing in your practice. Some tips if people want to keep this in mind. First thing you say, create a pain management plan prior to your procedure.
Yeah, so talking through a pain management plan with whoever's doing your procedure is a great step. If you are going in with pain to the ER, to the doctor's office, you can always bring a friend.
Yeah.
Right? Or bring a trusted confidant who can advocate for you on your behalf, especially if you're in so much pain that you can't even comfortably speak.
Right.
Or if you've been dismissed in the past and are afraid of those encounters, having someone to help you is certainly an option.
And truly speak up if you feel uncomfortable, if you feel that pain, don't hide it. Speak up about it.
Yes, if something's wrong, listen to your body and speak up about it.
And that goes with your next tip, which is trust your instincts.
Trust your instincts, yes.
Some really great tips. I'm so glad that we're having this conversation. It certainly needs to continue.
Yes.
All right, thank you so much. And if you're interested in learning more about direct care physicians of Pittsburgh or Rebel Wellness, we have links on our website. Coming up on the show, UPMC Children's Hospital of Pittsburgh has become a second home for two sisters who need regular treatments. We're learning more about their unique story ahead of the KDKA Free Care Fund Telethon. We'll be right back.